Thanks for joining us today. We'll hear from 4 physicians from Central Ohio Urology Group: Dr. Cunningham, Dr. Weiser, Dr. Taylor, and Dr. Block. Let's kick things off by seeing our agenda and getting an overview of your prostate and BPH with Dr. Taylor.
So today we're going to take some time to talk a little bit about the prostate gland, to talk about benign prostatic hyperplasia, or a very common condition where men's prostates grow throughout their lives. We're going to talk a little bit about how guys like me in the urology world diagnose BPH or prostate enlargement. We're going to talk about treatment options for prostate enlargement and for BPH, and specifically spend some time talking in more detail about the UroLift system procedure. So oftentimes I'll go through a whole long explanation in my office of what's happening with symptoms and what our options are to fix problems. And guys will just kind of raise their hand at the end and say, but what exactly is the prostate gland? So let's take a couple of minutes and talk about what the prostate gland really is. And interestingly, in men, the prostate gland is the joining point of our urinary tract and our sexual function. So specifically, it's a small gland, typically about the size of a walnut or so, that wraps around the urethra tube as the urethra leaves the bladder. It also produces the majority of the fluid that comes out at the time of ejaculation. And that'll be important later on as we talk about some of the potential side effects of different types of prostate enlargement treatments. There are a number of conditions that exist with the prostate gland that might lead a man to need to come to see a urologist. Prostatitis is a condition where we develop some swelling or inflammation of the prostate gland, sometimes because of a bacterial infection or sometimes because of environmental exposures. Enlarged prostate or benign prostatic hyperplasia is simply benign, that is to say, non-cancerous enlargement of the prostate gland, which is a very common thing that we as men develop throughout our lives. And of course, prostate cancer, unfortunately, is also common, but is typically a slow-growing condition and something that we evaluate further through blood work and examinations in the office. So our prostate glands grow over time. You know, the prostate grows in response to testosterone. And so the first phase of prostate growth is during our puberty. So during the sort of early teenage years, while the testosterone levels increase dramatically in our bloodstream, causing us to go through adolescence and ultimately to become, to develop normal male characteristics. During those years, the prostate grows to a normal size. But then as we age, since we continue to produce testosterone, our prostate continues to grow throughout our lives. Essentially, the older we are, the bigger our prostate can get. This is a very common problem. As you can see on this slide, increases fairly dramatically with age. About 60% of us are going to have some prostate enlargement, some benign prostate hyperplasia or BPH at age 50, 70% of us at age 60. And as you can see, as we continue to age, those numbers increase to the point that virtually all men are going to develop benign prostatic hyperplasia at some point throughout our lives. So what really is benign prostatic hyperplasia, and why is that a problem for us? Well, as we saw, BPH or benign prostatic hyperplasia is just the term that we in urology use for an enlarged prostate. Again, BPH is not prostate cancer. These are separate issues, but it involves enlargement of the prostate gland. I think it's important to say that BPH on its own is not a sign of or a risk factor for prostate cancer. PSA blood testing, which is a test that we in urology would commonly recommend, can increase both because of BPH and because of prostate cancer. So the blood test, the PSA alone, cannot tell us specifically what's going on. As we can see here, there is a major difference between a normal prostate gland and an enlarged prostate. As we saw several slides ago, the prostate surrounds the urethra tube as it exits the bladder. And as the prostate grows, it essentially squeezes down on the urethra tube, making it more difficult for us to get our flow started and making it more difficult for the bladder to empty. Just as concerning, as that process goes on throughout our lives, the bladder muscle has to work harder and harder in order to push our urine out, which can lead to damage later in life. So the symptoms of BPH are all of the kinds of things that as men we become aware of throughout our lives. So frequent need to urinate, having to go to the bathroom every hour, every couple of hours, day and night, having to run to the bathroom right away, or what we call urgency of urination. Sometimes there can be painful urination. We're really having to push the urine out. And even when we do push, our flow, or what used to be a flow, turns into a trickle. So a lot of guys tell me that, when they go to an Ohio State game and they got to use the restroom at halftime, they're standing there and 3 or 4 guys are going to cycle through in the urinals next to them because they're just sort of slowly trickling out their urine. It says here incomplete elimination of urine, but the way that really shows up for guys is just feeling like we don't get empty when we go, and sometimes having to go back to the bathroom 5 minutes after we thought we were done. Sometimes the flow kind of stops and starts while we're standing there, and these can all be symptoms of BPH. Of course, this affects us because it's something that we have to live with, but it often affects our partners as well. As you can see here, although only 8% or so of guys say that they're bothered by getting up at night to urinate, the vast majority of their partners, unfortunately, do notice this and wake up along with them. So this can be a real issue, not just for men, but for their loved ones as well. So obviously this all affects our quality of life, right? If we're having to get up to urinate every hour or 2 at nighttime, we're not going to get good sleep. We're going to have to plan our life around where the bathroom is. It's very common in my office to meet men who are effectively homebound. They stay home. They don't go anywhere. They don't do the things that they like to do or that they used to do because they have to know where a bathroom is at all time. And they worry about maybe having an accident because of that need to go right away. Using bathroom stalls instead of urinals. Well, this is a common thing as well, because if it's going to take us 10 minutes to empty our bladder, and as I say, we're at the OSU game and 3 or 4 guys are going to cycle through, sometimes that's embarrassing. And that's a situation that we don't like to be in. So we may choose to use a stall instead of a urinal. Some guys choose to sit to urinate instead of stand because of how long it can take to go. So these are all things that affect our quality of life. This is the kind of thing that I might see on what's called a cystoscopy, or a diagnostic test where we take a look in the bladder with a soft, flexible telescope. On the left, you can see what I would see with healthy bladder. It looks nice and smooth with healthy blood vessels in the lining there. In the middle, we can see that things are starting to get a little bit bumpy, if you will, on the inside. And that's what we call trabeculation. That happens when the bladder has to work really hard to squeeze and empty. So the bladder muscle gets thick, which may sound good, but it's actually bad because it means that the bladder's not functioning as well as it used to. The end result of that on the right is a severely obstructed or blocked bladder that may just not function as well as we want going forward.
Thank you, Dr. Taylor. Now let's hear from Dr. Cunningham on how to diagnose and treat BPH.
How do we diagnose BPH? Obviously, many types of ways that we can do this, taking a good medical history, obviously looking at the types of symptoms. We have what's called an IPSS score, which really looks at the types of symptoms that occur and how much of a bother it is. We will use these types of scores both initially to determine whether or not there's symptomatic prostate enlargement, and then as well as after treatment to determine whether or not we've made effective treatment. There's some other optional assessments. Obviously, in most people here, we're going to do a digital rectal examination to check the size of the prostate. Obviously, I'll do a PSA to concern, so we're not concerned about prostate cancer. Often, if the symptoms are severe enough, we will look inside the bladder with a little scope that goes up in through the penis into the bladder to look at the anatomy itself, even an ultrasound to look at the prostate size. And then we have some other tests that look at the function of the bladder. It's called like a uroflow or pressure flow. These are called urodynamic studies. And really what they're trying to do is determine whether or not the bladder is applying force and can't get the urine out past the prostate. There's also a new therapy out, diagnostic therapy out called the Eurocuff, where you void into a little cylinder, and it's essentially a pressure monitor like you would for your measuring your tires. It measures how much pressure you can generate when you go to urinate, and that will tell you basically if there's an obstruction there, and obviously you match that up with the symptoms that you're discussing. Yeah, as we said, symptoms: incomplete bladder emptying, feeling the need to go very frequently. Urinary frequency, intermittency of stream, stop and start, urgency to go if you have that small bladder that doesn't want to empty. Weak stream, obviously it's the donut surrounding the urine channel, so there's obviously poor flow there. Straining to urinate, really trying to force the urine out, getting up at night because obviously your bladder doesn't empty effectively, so you're forced to essentially get up much through the night to empty it over and over again, and that does affect your quality of life and obviously the quality of life of your significant others as well. And on the right is some of the symptom scores. We score these types of symptoms going anywhere from 0 up to 35, with being the most severe, and then quality of life is also factored into that as well. Treatment options, there's several. They run the gamut from less invasive to more invasive. Thankfully, we're having more options in between. In the old days, before we had medicine, we used to just have to take people to the operating room, and we just essentially had to remove their prostate, go in and scrape it out from the inside. Now we have a lot of therapy options, ranging first from watchful waiting, which in some men, if they're not bothered by the symptoms, we essentially will just tell them to monitor and to follow up with us at regular intervals. And what we're then able to do is follow them in terms of how well their bladder's emptying, making sure they have adequate kidney function, all those types of things, no infections. And then we follow them. Then we often will move to medical therapy, which is called there's two types of therapies: alpha blockers, which relax the muscle around the prostate gland, as well as 5-alpha reductase inhibitors, which are medicines designed to actually stop some of the hormones in your body that cause the prostate to grow and actually allow the prostate to shrink. Some of the minimally invasive options, obviously the UroLift, which we have a lot of experience with. It's a great therapy. It's a mechanical therapy to essentially open up the prostate tissue without having to destroy tissue or destroy anatomy within the gland. It acts as a mechanical opening that allows things to flow. Water vapor therapy is something as opposed to the Resume, which is essentially a needle ablation therapy where you're placing a needle into the prostate gland that will then essentially create heat that will kill that gland and shrink the tissue. And then over time, you're going to be able to void better. That often will require a catheter after the therapy, whereas the UroLift, in about 90% of the time, we don't have to have a catheter. Guys tend to void post-procedure in recovery and then on to home. The more invasive therapies involve laser, where you go in and actually use a laser in the operating room to destroy prostate tissue. That usually requires a catheter in place for a couple of days, possibly an overnight stay. And then the standard surgery, the TURP, which is the Roto-Rooter, where we used to go in and scrape out the tissue. We still do that. And that essentially removes all of that tissue. And once again, a hospital stay with that. Some of the different types of things, as we discussed, the watchful waiting, obviously there's nothing done there. So you sort of watch things. Medications can have relief with a low risk profile. They're overall safe. No surgical intervention. The UroLift, as we see here, obviously no catheter, minimally invasive, low risk, good durability. A lot of these therapies, as you move towards minimally invasive therapies, have good durability of care, which means they last 5, 10, 15 plus years. The UroLift does not involve any cutting. Some of the other tissues do involve heat or removal of the tissue. Sexual function is something we look at. Obviously, some of the medical therapies can have what's called retrograde ejaculation, and where you obviously can't ejaculate, it'll go backwards into the bladder, and you just void it out afterwards. That is something that also can occur with some of the more destructive therapies like the vapor therapy or some of the standardized laser or transurethral resection as well. Obviously, no side effects from medicine. The surgical options are designed for that. And then no ongoing medicine afterwards, which is the goal of a successful intervention therapy, is to get you off of medicines and get you back to normal as soon as possible.
Thanks, Dr. Cunningham. It looks like the UroLift procedure checks off all the boxes. Dr. Weiser, could you tell us exactly what the UroLift procedure is?
So what exactly is the UroLift? Well, some exceedingly clever engineers tried to build a better mousetrap. And in the UroLift, I think that they have. What they've done is as you can see from this cartoon, they've taken that enlarged prostate that's blocking the flow of urine. And when you put a camera in and you can see where the blockage is, you can deploy some very tiny little, I call them bungee cords, that actually pull apart the prostate, physically pull it apart. They're not removing the tissue, but it pulls it apart. So it opens up by step 3, a beautiful channel for which you urinate through without affecting any of the sexual functional apparatus in your body. The implant is permanent, but it is exceedingly inert, meaning it causes zero harm. It has a little suture with 2 little tabs. One is made of a polymer called nitinol, which was invented for the space program years ago and is, again, inert and is an incredibly useful material, and stainless steel. I want you to think of this as basically like the surgical clips that we use all the time, each and every day for decades in surgery. They don't bother you, you don't bother them, and we live in absolute harmony as this device pulls the prostate apart, stays in there permanently, affects its change in your urinary flow without causing sexual side effects, doesn't lead to infections, doesn't lead to degradation or damage to your internal organs. It also is MRI safe. It's frankly, like I said, a very clever fix. This cartoon in this video will demonstrate to you how the UroLift system works in real time.
The UroLift system is a new minimally invasive technology designed to relieve urinary symptoms and improve quality of life for men with an enlarged prostate caused by benign prostatic hyperplasia, or BPH. As the prostate becomes enlarged due to BPH, it presses on the urethra from the outside and causes it to become blocked. Relieving obstruction of the prostate is clinically proven to improve urinary symptoms in men with BPH. Under endoscopic guidance, the UroLift system is gently placed into the urethra to the area blocked by the enlarged prostate and moves the obstructing prostate tissue out of the way, thus opening the urethra. Through a fine 19-gauge needle, an implant is deployed that holds the prostate in this new, less obstructed shape. The UroLift system is designed to offer a new way to relieve prostatic obstruction without cutting, heating, or removal of tissue. Next, the same technique is applied to the other side of the prostate. Because the outer capsule of the prostate is typically firm, it holds the urethra open. The number of implants required depends on the size of the prostate and the degree of obstruction. Typically 4 to 5 implants are used. Before applying the UroLift system, the urethra is blocked due to an enlarged prostate pressing on it from the outside. After applying the UroLift system, the prostate lobes are pushed aside, leaving an open urethra.
Thank you, Dr. Weiser. Now let's hear from Dr. Block about what to expect during and after the procedure, and what to do if you think you're suffering from BPH.
This is a schematic of before the treatment and after treatment. As you see on the left, you have the obstructing lobes of the prostate. After placement of the UroLift staples, you can see opening into the bladder neck, which leads to a wide open system. After the procedure, generally no catheter is required. There may be some bleeding, but minimal. Some patients experience a short-term pelvic pain, but rapidly resolves. a quick return to normal activity. The symptoms improvements are demonstrated as early as 2 weeks and continue to improve up to 3 months. If you have symptoms of BPH, the next thing you can do is take the International Prostate Symptoms Survey. You will then have an idea how significant your symptoms are. If your symptoms bother you enough to seek help, then go ahead and schedule an appointment in our office, and we'll be able to evaluate condition and see what best suits you for this condition. I'd like to thank you for your time and joining us. We'd be glad to see you and evaluate your symptoms. Please feel free to call our office and make an appointment.
Thank you for attending today's presentation. Please call the office to book an appointment to find out if the UroLift system is the solution for you. You can also click to request an appointment.